Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 hello. Welcome to our weekly show. I'm Abby, your healthy living NP. How are you guys doing? Hope all is well. For those of you who are regular members, I say welcome back. For those of you who will be joining me for the first time, I say welcome. We are here weekly, and I do the shorter videos during the week. So please like and follow. Please give me a like right now because it's going to be a great show. Please share, please share, please share. Okay, so let me get started over here. As you can see, today's title is Tips to Help Your Teen Transition from Pediatric to Adult Care. I was just on another thread the other day and I realized I said I haven't done too much about topics about children or young adults and all that, teens and young adults. So decided to bring this again. Again, I'm a provider, but I'm not your provider. I'm not your child's provider either. So please make sure to not make any changes to your regimen without checking with your own provider or their pediatrician. Alrighty, so let's get into the show. Let me just get to my manners here. Again, please share the show. Please share the show. Now, so talking about transitioning your care, your child, your teenagers to adult care, because from birth to about 18 years, depending on the pediatrician and all, they can follow up. They can see the pediatrician, meaning somebody who takes care of children from 0 to 18. Some pediatricians would continue taking care of you up until age 21 or so, but most of them stop at age 18. Again, also with different states and all that too. So, but as they get older, younger, especially when they get to that age where they're like 11, 12, they don't want to be going to go see the pediatrician anyways to start giving oh man, I don't want to sit there with the younger kids and the babies and everybody's crying. I'm getting too old now to go to the baby doctor like they usually say. So how do you get to the point where you start transitioning them to get ready for adult care? Going to adult a doctor too can also be scary, and the transition can be a little bit stressful too for your teenager. Alrighty, so but it's good to start early. The American Academy of Pediatrics recommend that you start this conversation like around 8 to about maybe 12-ish, 11 to 12. All right. And then just start as early as 12. To start, first of all, to start off, finding a pediatrician for your child, as when you get to that point, is very difficult. Not for so difficult, but it's a very important decision that you have to make because their child is going to be going to this person for a long time, and they develop a bond with that doctor or the other doctors or the providers in that practice after a while for them to move on, transition to the adult care. Now that can be scary for you and the pediatrician as well, not the pediatrician and the child also. So start this conversation about, age 12 to 14 or so. All right. Start telling them eventually you're going to start moving on. When you turn 18, you can stay here. You can actually, the pediatrician, you can stay here and slowly getting the care that you need and all that. And we don't have to move until you're 18, but start telling them now. All right. Saying eventually you're going to have to move if you do plan on moving in before then, because there's some general offices that see patients. Like when I worked in primary care, I saw patients as young as 16. There's some offices that would see them even before that, especially let's say if you live in like a small community, you don't have separate pediatrician, they don't have all of that. They have like a general practitioner that sees everybody, or sometimes in the same practice, it can have the pediatrician in one office and then the general doctor in another, adult doctor in another, in the same building. Okay, so depending on where it is that you live and all of that, and availability of providers in your neighborhood, in your community. All right, so you can start talking to them, telling them eventually you're going to start going to the big doctor and adult doctor. Use proper terminology. They shouldn't be afraid of that. And of course, at this point, you're going to start familiarizing them. Let me just go in here. Start familiarizing them with their medications and all that. Saying, okay, this is the medication you take. Somebody don't take any medications except, let's say, when you're sick and they have to start on antibiotics, or maybe they take something for the eyes, or maybe. But if they have chronic illnesses and all, you stop familiarizing them with their medication. I take this medication. I take my albuterol. That when I'm short of breath, I need to take that for my asthma. I take this because I have diabetes. I need to take, and they have to know the dosage. Because prior to this, now you also sending them, if they take medications that they have to take in school, you have this whole list that you have to send to the pediatrician, to the nurse at the school. And by law, it has to be sent from the doctor's office directly to them when you do their physical form every year. So they're not too familiar with the medications that they're taking. But at this age, you start talking to them. This is the medication you're taking, or you have to take this medication with certain when take this with food, or you have to take this during this time of the day. You have to take that at night when you go on camping, or you go into your family visit, or you go on vacation. These are the medications you have to make sure you have them packed away. They have to be stored. Maybe this one has to be stored in the refrigerator. Maybe this one, when as soon as you get there, you have to put this in the cabinets and all. So start familiarizing them to them. So usually around like 11 to 12 is just when they start understanding more about their body and all, because that's also the transition time when they start going to the developmental period too. So it's good to start familiarizing them with them. Start going with them to the pharmacy and all that. You go to the pharmacy, say, okay, I'm here. This is the medication. This is my prescription that I brought from the doctor to get this medication. Most doctors now, depending on the office, we're sending the medication directly to the pharmacy, electronically to the pharmacy. So before you leave the doctor's office to the pediatrician's office, ask, okay, these are the medications. The pediatrician will tell you, this is the medication I'm prescribing. Okay, familiarize yourself with that. So when you go pick it up from the pharmacy, you can say, okay, this is the medication I'm expecting to get. The doctor said I'm going to be taking this dose and all that. So you can have that written down too. And plus, they can give you the printout of the visit also, and go there. The pharmacist will probably ask you, do you have any questions? Have them ask the questions, so you can have your child ask the questions too. Oh, what am I supposed to expect if I take this medication? Am I going to have any reaction? What reaction am I going to have? If am I going to have a rash? Am I going to start having anything that's going to start making my throat itch, or what are the things I'm supposed to be looking for, especially important side effects and all that. Make sure they ask that question. And if you're going to ask that question too, ask the question while they're there, so they understand that. Because sometimes, you leave the kids, and especially in 11, 12, they don't want to go into the store with you anyway, so they want to sit in the car. Start bringing them in, okay, and start familiarizing them with their medications and all that, because eventually they're going to have to start taking that on their own. And if they go away to somewhere, so some event, they're going to have to start taking that on their own. And some of these medications, like most of the medications, are life-saving or life-sustaining medications that they need to take. All right. So the next one is educate them on family medical history. Now, I know depending on certain cultures and all that, we don't like to talk about too many things, and you don't want to burden your children with so many different medical history. I don't want my child to know that I had this disease, or and you want your children to be children and all. But it's important, because again, you're preparing them to go into the adult care, because when they go into adult care, they're going to have to fill up all those forms, and that doctor's office is going to ask them, okay, what's your family medical history? You don't want them sitting there like, oh, well, no, I don't. I remember, I know my mom was sick one time, and I know my father was sick one time, and I know somebody had to have surgery, but I don't remember, because they didn't talk to me about it, or I don't know exactly what was going on. I just have like a little surrounding history of what was going on. So talk to them about it. I mean, make it age appropriate. You don't want to scare them into everything that you had going on, but let them know, because again, they're going into adult care, and sometimes they maybe go into adult care when they're 16. They're not going to stay with a pediatrician long. And again, depending on the community that you live in, they may be in the same practice with their adult doctors too, and all that. Okay. And also, as a parent, when the kids reach a certain age, you can really go into the room with them in the doctor's office too, because they have to ask them certain questions too. Again, they may be asking questions about their developmental stages. And also, that would be if they have to do any kind of examination on the child, there will always be a medical assistant there, and also, or nurse, depending on the practice. All right. But it's important too, and there's certain things, like sometimes the kids are being abused, and they have to ask those questions too. So you're not going to be in the room when they ask them that. So, and if make sure everything is like, you're going to be talking to your kids, this is what they're going to be expecting. And also, it's important, we have to ask those questions when you're not there. All right. It's not like we're going to say push you out of the room. Most of the times when the kids are around that age, anyways, the parents usually just sit outside anyway, right in the waiting room. They don't come inside. All right. So educate them about their family history. Who has diabetes, especially if they have siblings. Sometimes that child may be completely okay, and it has siblings who have other issues. Ask them about the siblings. Ask them about their mom and dad. Ask them about their uncle, aunt. Any sudden death in the family. What was the death about? You remember that, so you can have all that written down. Start teaching them about that, so they're familiarizing themselves with that. Okay. So because it's not like to say, okay, yes, my mom had this, so that means I'm going to have it, or my brother had this. It's just, you share the same DNA, and that's part of your medical history, because you share the same DNA. All right. So let's get into getting here. I'm just gonna skip this one for now. You're going to be discuss developmental changes. All right, you at this age around 11 to 12 I talked about before. I'm going to bring this show again. I'm talking to your daughters about, about the talk, developmental talk, and talking about your son, reaching to puberty. For girls, you're going to start talking to them about age 8, because that's when girls start getting the changes, and boys, they usually start like around 9 to 10. So you're going to be talking about that. So you're going to be explaining all that to your pediatrician. The pediatrician would have talked that to you, but and hopefully as a parent you would have explained all that to your child too. Okay, some parents don't feel comfortable with this, so you may have to have the pediatrician explain that to them. And also some schools, they have the girls separated, like in the health class they have the girls separated from the boys, and they talk about puberty and all. I don't like the fact that they have to separate them, but I guess to make it like a little less awkward, because you want your son to understand what's going on with their, if they eventually, when they get older, when they get girlfriends, or the boys get going up and all that. I'm not talking about all the sexuality part and all, just to have an idea of humor, because again, somebody have brothers and sisters in the home anyway. You want to know, you want to familiarize them with it, but discuss with them. And when you decided to go into the adult care, okay, the kind of the doctor you go into and all that, so you feel comfortable going to that doctor. Maybe your doctor you go to as an adult, your child may not feel comfortable with that. So have that conversation. And also, again, like I said, you're going to be talking about the developmental changes. Some cultures, please do not shame your child. It's normal for your child to start growing body parts. Okay, not body parts, but like developmental changes. And I know sometimes they'd be like, oh, you think because you this now, so you think you're frisky. You think no, that's just a normal human body parts, and the hormonal changes and all. So have that conversation with doctors and all. And sometimes they feel better when they're talking to pediatrician in a smaller setting as opposed to talking to adult doctor, because they're going to be expecting them to have like adult responses or adult like responses, put it that way. So have those conversations and have them very often. Make sure they're comfortable. All right. And if you don't feel comfortable, you have a family member who is in the health field, you can ask that. They have classes at the YMCA, they have classes at school. And most of the times these kids already know more about it, but it's not proper information. So it's important that you're giving them proper information, because they have to protect themselves. Okay. So going to, if you're just joining me there, if you're just joining in, we're talking about tips on helping your teen transition from pediatric care to adult care. Okay. It's very, very important. All right. So next one, we're going on to special needs children. Alrighty. So I talked about that too, because when it not only special needs children, I also talk about chronic illnesses too, because at times that these kids could be also seeing other specialties too. Let's say they see a pediatrician seeing them for everything, but some of them may have to see the psychologist. Some of them have to see the psychiatrist depending on their medical condition and all. They may have to see the endocrinologist, so somebody who has thyroid issues or diabetic issues. Even if there's something going on with their feet, they may have to see the podiatrist, the eye doctor, and all. Some of those specialists and all that, they only see pediatric patients. All right. So they may say, okay, they will get into this age right now. We cannot continue seeing you. You have to find, you have to, start transitioning to an adult endocrinologist, an adult cardiologist, so just a heart doctor and all that. So you have to start asking that conversation, having that conversation with the doctor, saying, okay, I know my pediatrician, they may be able to see them until they're 21, or this person may be able to see them, but are you going to be able to continue seeing them at this age and all? So start having that conversation around like age again, especially with a pediatrician and all, or the pediatric oncologist or pediatric podiatrist and all. Start asking that question now and see what they plan on doing and the age limits and all that. Okay, for special needs children, some of them stay with those people because they see them all through the lifespan, but just ask that question. Don't want to assume that that's what's going to happen, because especially with special needs children too, it's a special care that goes along in transitioning them from pediatric practice to adult practice, because I had some of those patients too, and most of the time it's like, okay, you want to be very careful. All right. So ask those questions now, saying, will you be able to see my child after when they turn 18? All right. And then, like I said, you can say, oh, some people can see that. Like I'm a family nurse practitioner. I can see everybody from zero to the end through the lifespan. Okay. But also a pediatric nurse practitioner may not be able to see patients after age 18, because they're not trained, they're not licensed to take care of patients after age 18. All right. Adult nurse practitioner, adult general nurse practitioner may not be able to see anybody below age 18. So it's important when you're making those decisions for your family, you asking those questions along the way. Sometimes, again, like we have somebody in the practice that does see people in that age, but not the person that you're seeing at the time. Okay. So we'll talk about when you go there, let's say you go there for the first time. Okay, my child's going there to the doctor's office now, and she's about 16 or he's about 16, and he wants to go there and he's afraid to go, and or she's afraid. How do we do it the first time? You can start, sit down, say, okay, go ahead, pick up the phone. You're going to call to make your appointment. All right, they're going to ask you, this is your first time. You can give them information. They won't ask you everything on the phone. They'll ask you about your, maybe the insurance card that you have, the kind of insurance you carry. Let's look at your deductible, all of that. You put the card in front of your child and you can ask all those questions and all that. Okay. The first time you go there, you may be a little nervous. Some places do, they won't allow the parents to come in. We have to ask the child's permission. All right. Even though that child's like maybe 16, 17 years old, we still have to ask, do you want your mom or your dad or your guardian to be in here? So sometimes you'd be like, oh, it's the first visit, I want to be in there. Yes. Okay. You can come in and all that, and you can sit there. I mean, I want you there. They may ask you questions and all. So you want to be there and answering those questions too, because they don't already know all of that. And they're not going to remember everything you told them during the years, because they'd be like, yeah, okay. And they're not going to remember that. So you want to be able to tell them, okay, this is, of course, your date of birth. This is your father's side, what they have in your father's side. This is what we have on your mother's side. These are your allergies. These are the surgeries that you had when you were younger. All those things are going to apply to that. So you make them comfortable. Sometimes you may just want to, if it's not possible to go with them, you can just listen on the phone and ask that question. And sometimes when your child's going there, you feel uncomfortable to just go in by themselves. So if it's possible, go with them with that visit. Okay. Stop making them more responsible at the same time, but go with them to just be a buffer, because they're nervous and they're not going to remember everything. And plus, when the doctor or the provider comes in there, they're in there for like maybe 10 to 15 minutes and you forget everything. So have some things written down too. Okay. So I think I don't see any comments there. Um, Excuse me one second here. I'm getting thirsty. And so some of the questions you can ask you. When does my child start to meet with you alone as part of the visit to become more independent in their care? So you're talking to a pediatrician now. What does my child need to learn to get ready for adult care? Do you have any checklist or self-care list that my child needs to learn? Most hospitals and pediatrician's office they have a checklist. I think on Children's Hospital of Philadelphia and other places, you can go, and most of the time you can go online and also get the checklist too. Okay. Can I work with you to prepare a medical summary and emergency care plan for my child? Before my child turns 18, what information about privacy and consent do we need to learn about? If my child needs help making health decisions, where can I get the information? All right. So, and then at what age does my child need to change to a new doctor for adults? And do you know any adult doctors for my child to transfer to? Because again, like I said, you may not want them seeing your doctor, but it's always best to kind of like have them see your doctor. And also, don't forget to, these kids may be turning 18 and going away to college and all that. So you also want to be looking to where they're going to be seeing doctors at the same time. You can look online and also get that information as well. Or the college that they're going to can provide information as well on that. Okay. Don't transition before you get, let's say they're supposed to get medication, anything that has to do with, let's say, ADHD or their insulins and things like that. Make sure you have all that prescribed long in advance before you go to the next doctor, because if you're looking for this doctor's office, or say your own doctor, all right, they may not be taking new patients at a certain time, especially during the time where they're doing open enrollment and all. So check with them first. So have enough medications and everything there before you transition. So that way, when they're transitioning and they don't give you an appointment for another month or so, you have enough medication there. Okay, you have enough insulin. You have all your especially the things like for ADHD, they can give medication that are narcotic or like narcotics or like stimulants and all. Some other doctors will say, I'm not renewing that medication until I physically see the child. All right, physically see this young adult. So it's important that you have enough. You can just tell them, we plan on transitioning and all, can you please make sure we have all that medication ready? So if there's any kind of delay, and especially if you're moving, also have all that medication, because you're moving to another, even if you go into another pediatrician somewhere else, they may say, I'm not prescribing that medication until I physically see the child. Okay, there's a lot of legal things into that too. Okay. So it's important that you do that. And again, like I said, go back to chronic illnesses. It's very important that you ask those specialties, will you be following me after my child leaves to go to an adult care? All right. So Of course, at this time, it's like when they're going to high school, some of them getting out of high school and college can be a little more stressful. So learning these skills and all that and working along with your child makes it so much less stressful when they're going to adult doctor. I saw this TikTok thing where it's like, oh, mom, what's my date of birth? They're asking me these questions. Do I know this? Am I supposed to know this and all? So they were making fun, but that's true because I've seen some patients before where they come and then they don't have most of that information, and we don't look bad on them. We're just saying it's just helpful you have all those information so we can have all that information in order to provide the plan of care for you. Okay, so I don't see any questions there, and hope you share this video. Also leave your questions and comments below, and I answer them when I'm offline too. Okay, so thank you all for watching. Facebook's got this thing where like the thumbnail is gonna make me look kind of crazy, so if you see the thumbnail, just ignore it. But thanks for watching, and I will talk to you guys next week. And also watch out for Abby's Daily Dose. If you're not a member of Abby Tyler's Healthy Living page, please look on this logo right here. Right here, look at that where it says page and it's joy. Okay, so if you're watching from Focus in Liberia or somewhere else, or also YouTube and all, please click and like, because I put on Abby's Daily Dose during the week, shorter videos where I do some health stuff there. Other thing I saw, let me see here. Okay, Dennis said, in Liberia, we normally describe special needs children in derogatory terms. What advice do you have for our people in Liberia who normally use the child's condition to describe them? Oh, that goes back. Let me put that question back in there. Oh, sorry. That goes back to, I guess, to having a conversation with the community. People also do that, like in the religious stuff and also community stuff. So start using proper terminology, and I think that comes along with a lot of teaching and all, because we have people. I had a friend who family member has some issues and some psych developmental issues, and then they send it back to Liberia to. And it's like, what are they going to do in Liberia when you send them there? Because people just say, oh, maybe this is witchcraft, maybe this is this and all. So it comes to a lot of education, and I implore the health providers in Liberia, the doctors, nurse practitioners, PAs, nurses, and all that too. It's very, very, very important that we get to the point where we start using proper terminology. That comes with lots and lots of education on the parts of the providers and all that, to say, this is what it is. You're sure this is what we're gonna call it. We don't call people these names. We don't call people that name because it's really hurtful. And if you don't know any different, I mean, I talk about the fact that when we were younger, we had this girl who had like really large eyes, and we used to be so afraid of her because we thought, she was witchcraft and all. To come to find out, she had thyroid eye disease. And sadly, if she was over here or people knew more about it, she would have just gotten the medication that she needed to be able to live a productive life. But she spent most of her time with people, kind of like staying away from her. Even her child, we stayed away from her. So it's important that we start with proper terminology. That comes from also going back to the schooling. And also you say, okay, nope, that's not what that is. Even over here too, among some of our Liberian people, we do that. So no, please. And so you hear somebody saying it, stop it right there. Be the one to say, stop it right there and say, no, that's not what it's called. And don't call the child that. Okay, so it's very important. It starts with the education from the school, and then public health people, to get the public health people involved, to start saying, this is what we're going to do. It's not saying, oh yeah, politically correct or whatever. It is hurtful because the child grows up with emotional pains and all that, knowing that, okay, this is what they're calling me. Even now we're talking about Zogos and all that. Why are we calling people that? You wouldn't call people like that in developed nations. So why are we doing that? All right. So it starts with the public health people. I implore you, in the public health back home, start now. Start there. Start with the education and all. Okay. And then the medical school and nursing school and all of that. Okay, so thanks for the question. And of course, like I said, you guys can leave more questions below. All right, and I answer them during the week too. So let me go back here and just put my glasses back on. Again, like I always said, if you have any alrighty. Alrighty, so we'll go on from there, and thank you all for watching. I wish you guys a beautiful rest of the night, and stay tuned, and I'll see you guys again. If you're watching for Focus on Liberia on YouTube, please like and follow Abby Tyler's Healthy Living page, because I put on the shorter videos during the week already. So good night, and take care. Bye-bye now.